Oxygen diffusion depends on the partial pressure gradient, membrane thickness, surface area, and diffusion coefficients. While oxygen is less diffusible than carbon dioxide, the steep gradient and large surface area of the alveoli ensure adequate transfer under normal conditions. Diffusion impairment becomes clinically relevant in conditions like interstitial lung disease, pulmonary edema, and fibrosis, particularly during exercise when that transit time is shortened. In systemic capillaries, oxygen diffuses from blood with a partial pressure of oxygen at around 95 millimeters of mercury into tissues which have a much lower oxygen partial pressure, around 23 millimeters of mercury or even less. Venous blood levels leave the tissue, or venous blood leaves the tissue at around 40 millimeters of mercury of oxygen, reflecting this balance between oxygen delivery and metabolic demand. Tissue oxygenation is therefore a dynamic variable. It is tightly regulated by both blood flow and cellular metabolism. When blood flow increases without a change in metabolic rate, this could be during vasodilation, our tissue oxygenation rises. Oxygen delivery will exceed oxygen consumption unless oxygen is extracted per unit of blood. This scenario is common during exercise, specifically warm up, or a pharmacologic vasodilation, and demonstrates how perfusion alone can alter tissue oxygenation. Here, though, looking at a different scenario, metabolic demand increases, ATP consumption rises without a compensatory increase in blood flow. As a result, tissue oxygenation, the partial pressure, will drop because oxygen consumption outpaces delivery. We can see this here. This scenario occurs in early exercise, ischemia, or even sepsis, and highlights why metabolic demand must be matched by circulatory adjustments to prevent tissue hypoxia. Without increased perfusion, rising metabolic demand leads to declining tissue partial pressures of oxygen and potential cellular dysfunction. The imbalance activates local vasodilatory signals, things like adenosine and nitric oxide, to restore oxygen delivery. Failure of this compensatory mechanism is central to ischemia. Next, we'll talk about carbon dioxide diffusion.